All right. Well, hello, everybody. This is Michael Sisha. I'm the Chief Marketing Officer at One Cosmos. I've invited our Chief Strategy Officer, Mike Engel, here today to talk about healthcare. Mike, welcome to the vlog. I've done some poking around, some research around healthcare, and I've learned a little bit about this legislation that was passed in 2016 called the Omnibus 21st Century Cures Act. And to my surprise, this got pretty deep into some interoperability requirements. Can you talk a little bit about that?
Yeah, there's legislation and industry efforts that are trying to get something that should be very obvious, but access to your own data or to have your data be easily shared with somebody else, specifically in the healthcare world. So this has been a long time coming. People have been trying to revolutionize healthcare records and healthcare access for 20 years. And I think the big tech companies have all tried many times, but a lot of exciting traction that's coming about pretty recently in this front.
So this is interesting because it recognizes a lot of things that, we'd like to take for granted. We've all experienced this: a new pharmacy, a new insurance company, a new, healthcare provider. As a patient, you go in and you kind of start from scratch, provide all your basic information. Then, if you've got an old doctor has to send information to a new doctor. And, at over a lifetime, your information gets spread all over the place. So is this focused on solving that problem?
It is. It's taking a pragmatic approach to it, small steps. So I'll give you an example. Today, you go to your doctor for 5 years, and you happen to be in the state next door, and you go to the hospital. How does that hospital get access to your health records today? If you were to go to the hospital today, Michael, how do you think that would happen?
I expect a phone call or a fax or some kind of an email might be sent, and they would get it, right?
We're stuck in the 90s, right? It's really it's horrifying on many levels, from a technology perspective, from a verification of what it actually is. How do we know we're getting the right health records? So there's these efforts to modernize what they call the key, and we'll talk about this on our webinar coming up. The key is, how do you get in? How do you prove who you are? I am Mike Engel. Let's work on my health care together, right? In a safe way. And then there's the doors that you're actually going through, which is all of the entities today that hold our data, the hospitals, the specialty care providers. And they need to be able to exchange your information in a safe way as well, right? If for that doctor to send it to the hospital or vice versa, your blood work, right, needs to be federated around to lots of different people. And so they're trying to standardize and modernize how those two interaction points happen.
Okay, so this is starting to hit some familiar points here, because the very first thing is proving who you are, I guess, electronically or in a remote setting. And then there's the storage of information. So this seems to map pretty strongly into a lot of the themes we've been talking about when we talk about identity proofing and creating this digital wallet. Is that what's happening behind the scenes?
It is, yeah. I mean, the terminology may vary, but at the end of the day, I need a wallet or a safe place to keep my health records that I am in control of. Much like what we do for identity is I can allow you, Michael, to create your own identity wallet and have trusted credentials go into it, everything verified, matched to your, true world identity, et cetera. So the same principles should apply in the healthcare world. I prove who I am. I get access to my data, right? Because I don't generate that data. The hospital takes the MRI scan or somebody draws my blood work, but they should give it to me, and I should be able to share it with anybody that I want with the press of a button, but be in control of it at all times. And that's all in scope of what they're trying to accomplish.
Okay, so in practicality, in real world environment, how would this work? Does a hospital deploy this, or can you step us through how patients, you and I, would experience this in real life?
Yeah. So there's a lot of ways to answer that. Today, the way you get your health record created is you have to typically go to a provider. I'm going to the doctor's office or the hospital for the first time. show them a driver's license, give them some other information, and they will either create a new record or try to find you in their system. Okay, I'll match the address. Michael C. Schoen lives at 123 Main Street. Got you. And I'm in person with you. It's all verified. And then I can hand you now a login. And so it's very in person, high touch, still error prone because they could still get the wrong Michael C. Schoen. Imagine if you've had 5 address changes since you've been to that hospital last.
Right.
How do they find you inside the system? So these are all the things that they're working on. Now, the way it could work in the future, if we're successful in our mission, is you can prove who you are without a doubt. And there's some way then to easily match those health records, not just at that point, but even remotely and digitally. I have logins at Quest, LabCorp. Around me, there's 3 hospitals that I've been to over the years for various non-emergency things because I'm healthy. And I'm just kidding. But all my data is spread out, and I might have logins to some of them. I don't even remember. So that's the scope of the problem we're dealing with. And now you can do all that stuff remotely. So if I'm going to, say, do a teledoc session where I need to get medical care over Zoom or over something like this, now it's really important that you're talking to the right person and that you're talking to a verified doctor. So we can do all that stuff digitally now.
That's great. And we're not alone in this mission. There's an organization called CARIN, not the KAREN, it's the CARIN. And they're all around furthering the interoperability standards for the access and sharing of this, correct?
Yeah, that's right. The CARIN Alliance is a nonprofit, and we're going to talk in depth about this next week. But their mission is to bring payers and providers that serve users, right, like you and me, together and get some of these standards in place and create some real demonstrations of the art of the possible. So, for example, we're working with the CARIN Alliance now to demonstrate how you could prove your identity remotely to, say, one of the federal healthcare services, and then let somebody else rely on that trust. So imagine you go to Social Security and you say, I'm 58, I need my Medicare Plan B, whatever it is. You have to prove who you are. Shouldn't you be able to reuse that proof to a hospital or to your doctor so that they can easily consume your identity? You can share it with them, and then it can all go downstream from there. And that's one of the actual real world projects we're working on in the CARIN Alliance right now.
So this is pretty cool. So with the proper platform and framework that's interoperable, me as a patient, I could enroll remotely. All of my information is stored under lock and key that I control. And then as I go to a new provider or a new pharmacy, essentially I would do something as simple as, for example, scan a QR code, and we do a facial recognition, and now they get exactly the information I want to give them at the time I want to give it to them, right?
Exactly. Yeah. So the art of proving who you are remotely there's a federal standard for that. It's NIST 863-3. It says, here's how you do all this stuff remotely to prove somebody, match the face to the driver's license and all that. And these medical organizations and government agencies are now working to be able to implement that as a trusted way to prove your identity. And once it's done in one place, that same identity can be leveraged over and over again, right? So you don't have to go to hospital 1, prove who you are, go to hospital 2, prove who you are. Imagine if you go to the hospital and they ask you a question, do you have a Social Security account? I say, by Joe, I do. All right, great. I just need you to authorize the transfer of that identity information over to us so that, boom, we're in, and I can match the patient records very easily. That's the vision, right? There's many ways that it could be implemented, but that's one example of how it could work and make things a lot easier.
This is really fascinating. We're going from a world like we discussed earlier, where information is just spread, all over the place, to a world where it's in one place, it's controlled by the patient, and it's there when they need it. They share it selectively when they want to, and they get the services they need. So that's fascinating. Now, we are doing a webinar on this. If you're seeing this before the webinar, it's December 15th, 1 p.m. Eastern time, 10 a.m. Pacific time. Mike, you have some partners in this webinar, correct?
I do. Yeah, I'll be joined by Ryan Howells he's from the CARIN Alliance. So he'll be talking in depth about some of the the topics that I hinted on. And we're also being joined by Adam McBride, who's the IT director at Health and Human Services. So these are people that have been doing this for a long time. And we're working very closely with both of these organizations to try to make some of these things come to light.
Well, this is really amazing. Not just giving patients like you and I access to the services we need, but we all know that the healthcare records are one of the most sought after records by cyber criminals. So securing that information, especially as we move forward here and the attacks get even more creative and aggressive, it's really exciting to hear the work that's being done around this. Mike, thank you so much for joining me today. I appreciate your time. I'm looking forward to that webinar.
Pleasure. We'll talk to you soon.